I'm Danielle Devers from Student Health and Wellbeing. With me today to talk about sex in the time of COVID is Dr. Michelle Teti from the School of Health Professions in the Department of Public Health. Thanks so much for being here.
Hi, thank you for having me.
So, Dr. Teti, can you explain to us if COVID can spread through sex?
Yeah, sure. It very likely can. COVID is a respiratory illness and it spreads by respiratory droplets. So a lot of times when people are having sex, they're kissing, things like that. Obviously COVID can spread in those ways. It can also spread by those droplets being on someone and then you're in contact. So again, any activities that involve close contact, so sex or even talking close with somebody can certainly spread COVID.
So, how can people safely date and or have sex right now?
Yeah. In public health, a lot of times, so I've been working in the field of sexual health for probably about 20 years. I tend to think about sexual health and prevention in terms of ideals and then perhaps in terms of what we call harm reduction. Ideally, the best way to avoid getting COVID right now is just to not to be around other people. So when it comes to dating and sex, that would mean not dating or not having sex, abstinence for a select period of time. Those are going to be your just ideal kind of activities that guarantee you don't get COVID. But those ideals are sometimes not reachable, and sometimes they're unhealthy in other ways for people, right? Just mentally and socially to be isolated. Harm reduction is an approach that we use in public health that acknowledges there's going to be some risk and then takes into account what can we do to reduce some of those risks. If you are dating, again, we go back towards the sort of ideal end of the spectrum. Things like masturbation or having sex with like videos or pictures, virtually, all that stuff's going to be the least amount of risk because people aren't in contact. If you are in contact with each other, you can wear masks during dating or sexual activity. The other thing you can do is just try to limit your social bubble, and that goes for dating too. So it's going to be safest if you're dating or having sex with one person versus five, just because that's going to reduce your risk. That's another thing you could do, limit the amount of partners that you're around. You can also start to have open conversations with partners about how safe they're being. You cannot have sex if you're feeling sick or have symptoms or with someone else who's having symptoms. So make sure your partners are healthy. And you can take into account what kind of other underlying health concerns that your partner or partners may have. It may be more risky to have sex and potentially be dealing with a COVID exposure if you or your partner has asthma or some kind of, debilitating breathing illness or some kind of underlying condition. So that's kind of the way it is, from not having sex to not having sex with someone else to, doing things like limiting who's in your social circle or limiting the activities that you do or wearing a mask, that kind of thing.
Okay, that makes sense. So, what health issues should people keep in mind sort of outside of COVID if they are dating right now?
Yeah, so it's always good to talk about those things that we should always be thinking about in regards to sexual health. Having sex, especially if it's unprotected, can lead to unplanned pregnancy and complications related to that. Having sex with, not without protection can lead to STDs or HIV. Now and all the time, it's good to think about using condoms or birth control. Condoms and or other forms of birth control. And if you aren't able to see a provider in person, you can likely get those things virtually too. So you may know more about what student health offers. I'm sure that they're able to still talk to people about those things virtually. So I would recommend that as well.
Absolutely, yes. Student health is a really great resource for our students. Are there any ways that COVID could actually help people have safer sex and better relationships?
So I'm thinking that there is, and there's not a lot of evidence. There's no evidence about this at this point, but I'm hoping we learn more about it as time goes on. I like the idea that COVID is pushing people to talk to their sexual partners about risk. And it's really similar conversation that we encourage people to have around STDs or HIV, asking a partner, have you been tested? What kind of risks do you have? How many partners do you have? Who else are you having sex with? And those conversations can be hard to have, but essentially now we're being asked to have very similar conversations around COVID when we have to be in positions where we ask people, how big's your social bubble, and have you been at risk, and are you willing to wear a mask? So, I think that there's some hope that conversations around COVID can increase communication between people, which I think is always really good for relationships.